Hello everyone, this is Dr. Abhinav. So in this video today we'll be seeing about the most expected topics for Tamil Nadu MRB exam. So this exam is about to happen in few months and so these topics which I have told, kindly make sure that you have read at least once or twice before going for the exam. Okay. So before we start, if you haven't joined our Telegram group and YouTube, kindly join. The link is in description. You can get all the updates there. And this Tamil Nadu MRB preparation ebook is available. The link is in description. So all the mentioned things are included. So most of the topics which I'm telling today is already there in this ebook. So you can get this and make use of it. And I've also provided a separate schedule based on this ebook for preparation of this exam in 30 days. So there are other ebooks also. All the links are in description. So coming to the expected topics, so these topics are selected based on the previous year papers and the most common questions that is generally asked in uh, medical recruitment boards of Tamil Nadu and other states also. So starting with the topics, the important thing is coronary circulation and inborn errors of metabolism in biochemistry and genetics and its inheritance you can learn in pathology, and Bessel-Jares reflex you can learn in physiology, and personality disorders, anti-anginal drugs, Glasgow-Coma scale, colorectal cancers. Make sure you learn all the syndromes and vector-borne diseases and what diseases they cause. Each disease you will have to know. Brachial plexus, nerve supplies and the disorders of it. Neoplasia generally you'll have to know, and the specific genes also you'll have to know. And in ophthalmology, learn about trachoma. And in orthopedics, the eponyms, the named fractures. So make sure you learn all of those things. I've already given it in the ebook. Sympathetic receptors, mainly the beta receptors and the alpha receptors in pharmacology, and the hematology drugs, torch infections in pregnancy, COPD, asthma, helminth eggs, head trauma, and different types of CT scans finding in head trauma, DIC, leukemia and lymphoma, cardiac arrest, the reversible causes, indexes in PSM, neonatal mortality rate, maternal mortality rate, and all those things, and vitamins and their deficiencies. Thyroid, you'll have to know full medical part as well as surgical part. ABG, you'll have to know the causes for metacidosis and alkalosis and those kind of MCQs. And embryology, you'll have to know the basics of development at least till 8 weeks. And then important commonly seen poisons and their antidotes. HLA-B27, Bell's palsy, and the primary health center in PSM, appendix and Meckel's diverticulum, fetal presentations in gynecology, obstetrics, anorexia and bulimia, and aminoglycoside, antibiotics, mechanism of actions. In corneal anatomy and embryology, ASA classification in anesthesia, developmental milestones in pediatrics, cystic fibrosis, Epstein-Barr virus, and cancers caused by them, obstetric date calculations, and so gravida para those calculations, autosclerosis, lupus vulgaris, exo versus endotoxin, Down syndrome screening, shock in surgery and risk management, and incontinence, stress and overflow, and other types of incontinence as well. Lights criteria for pleural effusion, ophthalmology, lasers commonly used, fast scan and e-fast scan, nephritic versus nephrotic syndrome, facial fractures, the Leafoot fractures and other fractures, Ludwig's angina, Quincy, all the other kind of swelling seen in ENT, E. coli and its various strains, ovarian tumors, STD, leprosy, TB, gastrointestinal embryology, hypothalamic nuclei and its functions in physiology, GAT hormones, glycogen storage diseases, amino acid necrosis, CNS tumors, antidyslipidemics, diuretics, middle ear anatomy, glaucoma, anesthesia vaporizer colors, and CPR. So you'll have to know both uh, basic life support and advanced cardiac life support. So many of these topics I've already given in the ebook. So you can get that ebook with the link in description, and you have to know all these topics at least once because these are asked previously, and there are high chances that they can repeat about these topics this year also. So thank you so much and all the best.